Lower back pain and knee injury. If a client presents with lower back pain or a knee injury, it could represent a serious inflammation or a diagnosed injury. Lower back pain and knee injury are classified as musculoskeletal conditions. Lower back pain could be acute or chronic pain from lower back or a more specific area. Clients could experience dull to sharp stabbing pains, which may have been caused by poor posture, an incident, or an accident. Lower back pain can be caused by a slipped disc, back muscle pain, back ligament strain, or a non-specific lower back pain. However, the most common causes of lower back pain are ligament sprains, bulging discs, bone injuries, and poor posture. The knee is a hinge joint and is responsible for weight bearing and movement. It consists of bones, meniscus, ligaments, and tendons. The most common knee injuries are sprains and strains, meniscus tears, this is where the knee twists or pivots, a fracture, or overuse. Most common is the runner's knee. Both lower back pain and knee injuries are soft tissue conditions and require strengthening what is weak and stretching what is tight. Lower back pain, the core needs to be strengthened and the lower back needs to be stretched. With a knee injury, the area opposed to the pain sections needs to be strengthened and the specific pained area needs to be stretched. Some of the benefits of exercise for a musculoskeletal condition include increased strength, posture and balance, enhanced well-being, mood and sleep quality, greater joint mobility, flexibility to help maintain independence, reducing pain and fatigue, and improves reaction time to reducing the risk of falls. If a client presented with lower back pain or a knee injury and has signs and symptoms outside the scope of the fitness instructor, a referral to a medical or allied health professional would be sought. If a client presented with an absolute contraindication, for example, a suspected or known dissecting aneurysm, an acute systematic infection accompanied by fever, body aches, swollen lymph glands, the exercise would be ceased immediately. If the client presented with a relative contraindication, for example, chronic infectious disease or an uncontrolled metabolic disease, or mental or physical impairment leading to inability to exercise adequately, then the exercise would continue in the absence of triggers or symptoms with a medical or allied health professional's clearance. Modifications for the exercises I just completed with my client if they had lower back pain would be the fitness test of push-ups. I would change this to a wall squat as the client would be supported against the wall, keeping a close eye on them at all times and keeping the intensity low and making sure the client is comfortable. If form is lost, I will stop the client as they have fatigued as to not cause injury. Dumbbell chest press, there's no need to change this exercise as the client is lying on their back and their back is being supported. Again, you will need to keep a close eye on them, intensity low, reps low, make sure they're comfortable and make sure the form is correct. Again, if form is lost, stop the client as they have fatigue and to not cause injury. A longer rest period will be given before the next exercise. Single arm row, I would change this to a seated row to make sure the lower back is supported at all times. Intensity and reps low, client comfortable, correct form. Form lost, stop the exercise. The client has fatigued and we don't want to cause injury. A longer rest period between the next exercise is required. Bodyweight lunge, I would change the lunge to a leg press, where the client could sit back and be supported by the seat of the leg press and no curve of the spine, while still targeting the hamstrings and quadriceps without any risk of injury. Intensity and reps would be low, comfortable. The client would be comfortable. If form is lost or back is curving or arching, the exercise will be stopped, and so that no further injury or any injury would occur as the client has fatigued, and again a longer rest period before the next exercise. Step ups, I would lower the height so the client can hold the form correctly by landing in their heels on top of the step and when they step down off the step. Slow and controlled movements need to be used here, and I would keep an eye on the client at all times, making sure they're comfortable. I would be watching the temperature of the client to keep it regulated, as this is a cardio section. I would shorten the duration of the step-ups and exercise. And again, if the form was lost and they weren't landing in their heels or they seemed out of breath, I would stop the exercise as the client's fatigued to make sure no injury would occur. Ground up runs, I would change this exercise to touch and run and not getting up and down, as this would increase and decrease the heart rate too much. Close supervision is kept on the client at all times. I would shorten the exercise and I would make sure that form is being held, and once they have fatigue, stop so that no injuries are going to occur. Following modifications are for a knee injury with the exercises I've chosen. The fitness test of push-ups, I would change this to a wall push-up so the client was not on their knees at all. Watching the client carefully, intensity low, make sure they're comfortable, the form is being held. Again, if the form is lost, we're going to stop the exercise. Dumbbell chest press, no need to change this exercise as the client is lying on their back and the knee is not being used at all. Again, watching for all the signs of comfortable, intensity is not so high, reps are kept low, and talking to your client to make sure that they can still talk back to you. Once their form has been lost, fatigue has set in, so you need to stop the exercise and again give them a longer rest period before the next exercise. Single arm row, I would change this exercise to leaning or on a supported bench or a chair so that the client was not using their knees at all. Keeping the intensity low, reps down, forms being lost, stop the client, we don't want to cause injury, longer rest period before the next exercise. Bodyweight lunge, I would change this to a fit ball squat where the client would be able to sit on the fit ball, therefore they're not putting any pressure at all on their knees. I would watch the client carefully, I would keep the intensity down, I would keep the reps down, make sure your client is comfortable. If form is lost, stop the exercise as the client has fatigued. A longer rest period will be given before the next exercise. We come to the cardio section of step-ups with a knee injury. I would lower the step height so the client can hold the form correctly by landing heel first on the up and on the down. I'll make sure the client is activating their glutes, as with the core, to take the pressure off the knees. I would make sure the client use slow and controlled movements. Keep a close eye on them and watching the temperature of my client is regulated. I would shorten the duration of the step-ups, and I would also shorten it if the form is lost and stop the exercise altogether to make sure that no injury will occur. And lastly, the ground up runs, I would change this to a touch and run at each end of the room, not getting down on the ground because the movements would not suit with the rising of the your heart rate rising too high. And also with the knee injury, you don't want your client getting up and down using their knee. Watch your client at all times, making sure their temperature is regulated. Shorten the duration of the ground up runs to the touch at each end run, and if the form is being lost, stop the client altogether as they have fatigue to make sure no injury will occur. Again, before the next set of exercises, make sure there's a long rest period